Hi everybody, this video of mine is about diabetes mellitus, which is a very important topic because this disease is very common all over the world. This topic is very lengthy, but I will try to concise it and I will tell you the important points about this illness. If this video gets prolonged, I will divide it into more than one part. Okay, now let's jump into the topic. Well, diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar, that is glucose. Glucose is vital to your health because it's an important source of energy for the cells that make up your muscles and tissues. It is also your brain's main source of fuel. The underlying cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excess sugar in your blood. Too much sugar in your blood can lead to serious health problems. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. Potentially reversible diabetes conditions include pre-diabetes. When your blood sugar levels are higher than normal but not high enough to be classified as diabetes, so this is known as pre-diabetes. And I'll talk about gestational diabetes, which occurs during pregnancy but may resolve after the baby is delivered. Coming to the symptoms of diabetes. Diabetes symptoms vary depending on how much your blood sugar is elevated. Some people, especially those with pre-diabetes or type 2 diabetes, may not experience symptoms initially. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss. Presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there is not enough available insulin. It may also cause fatigue, irritability, blurred vision, slow healing sores, and frequent infections such as gum or skin infection and vaginal infections. Type 1 diabetes can develop at any age, though it often appears during childhood or adolescence. Type 2 diabetes, the more common type, can develop at any age, although it is more common in people older than 40. If you suspect you or your child may have diabetes, if you notice any possible diabetes symptoms, contact your doctor. The earlier the condition is diagnosed, the sooner treatment can begin. If you have already been diagnosed with diabetes, after you receive your diagnosis, you will need close medical follow-up until your blood sugar levels stabilize. Now coming to the causes. To understand diabetes, first you must understand how glucose is normally processed in the body. How insulin works. Insulin is a hormone that comes from a gland situated behind and below the stomach that is known as pancreas. The pancreas secretes insulin into the bloodstream. The insulin circulates, enabling sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. Coming to the role of glucose. This is a sugar. It's a source of energy for the cells that make up muscle and other tissues. Glucose comes from two major sources, food and your liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Your liver stores and makes glucose. When your glucose levels are low, such as when you have not eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. Causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown. What is known is that your immune system, which normally fights harmful bacteria or viruses, attacks and destroys your insulin producing cells in the pancreas. This leaves you with little or no insulin. Instead of being transported into your cell, sugar builds up in your bloodstream. Type 1 is thought to be caused by a combination of genetic susceptibility and environmental factors, though exactly what those factors are is still unclear. Weight is not believed to be a factor in type 1 diabetes. Now let me tell you the causes of pre-diabetes and type 2 diabetes. In pre-diabetes, which can lead to type 2 diabetes, and in type 2 diabetes, your cells become resistant to the action of insulin and your pancreas is unable to make enough insulin to overcome this resistance. Instead of moving into your cell where it is needed for energy, sugar builds up in your bloodstream. Exactly when this happens is uncertain, although it is believed that genetic and environmental factors play a role in the development of type 2 diabetes too. Being overweight is strongly linked to the development of type 2 diabetes, but not everyone with type 2 is overweight. Coming to the causes of gestational diabetes. During pregnancy, the placenta produces hormones to sustain your pregnancy. These hormones make your cells more resistant to insulin. Normally, your pancreas responds by producing enough extra insulin to overcome this resistance. But sometimes your pancreas cannot keep up. When this happens, too little glucose gets into your cell and too much stays in your blood, resulting in gestational diabetes. Now let me tell you the risk factors. The risk factors for diabetes depend on the type of diabetes. First, let me discuss about type 1 diabetes risk factors. Although exact cause of type 1 diabetes is unknown, factors that may signal an increased risk include family history. Your risk increases if a parent or sibling has type 1 diabetes. Environmental factors. Circumstances such as exposure to a viral illness likely play some role in type 1 diabetes. The presence of damaging immune system cells, that is, which are autoantibodies. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes, but not everyone who has these autoantibodies develops diabetes. Geography. Certain countries such as Finland and Sweden have high rates of type 1 diabetes. Coming to the risk factor for pre-diabetes and type 2 diabetes. Researchers don't fully understand why some people develop pre-diabetes and type 2 diabetes and others don't. It is clear that certain factors increase the risk, however, including weight. The more fatty tissue you have, the more resistant your cells become to insulin. Inactivity. The less active you are, the greater your risk. Physical activity helps you control your weight, uses up glucose and as energy, and makes your cell more sensitive to insulin. Family history. Your risk increases if a parent or sibling has type 2 diabetes. Race. Although it is unclear why, people of certain races including black people, Hispanics, American Indians and Asian Americans are at higher risk. Age. Your risk increases as you get older. This may be because you tend to exercise less, lose muscle mass and gain weight as you age. But type 2 diabetes is also increasing among children, adolescents and younger adults. Gestational diabetes. If you develop gestational diabetes when you were pregnant, your risk of developing pre-diabetes and type 2 diabetes later increases. If you gave birth to a baby weighing more than 9 pounds, that is 4 kilograms, you are also at risk of type 2 diabetes. Polycystic ovary syndrome. For women having polycystic ovary syndrome, a common condition characterized by irregular menstrual period, excess hair growth and obesity increases the risk of diabetes. High blood pressure. Having blood pressure over 140 systolic and 90 systolic millimeters of mercury is linked to an increased risk of type 2 diabetes. Abnormal cholesterol and triglyceride levels. If you have low levels of high density lipoprotein, HDL, or good cholesterol, your risk of type 2 diabetes is higher. Triglycerides are another type of fat carried in the blood. People with high levels of triglycerides have an increased risk of type 2 diabetes. Your doctor can let you know what your cholesterol and triglyceride levels are. Coming to the risk factor for gestational diabetes. Any pregnant woman can develop gestational diabetes, but some women are at greater risk than are others. Risk factors for gestational diabetes include age. Women older than age 25 are at increased risk. Family or personal history. Your risk increases if you have pre-diabetes, a precursor to type 2 diabetes, or if a close family member such as a parent or sibling has type 2 diabetes. You are also at greater risk if you had gestational diabetes during a previous pregnancy, if you delivered a very large baby, or if you had an unexplained stillbirth. Weight. Being overweight before pregnancy increases your risk. Race. For reasons that are not clear, common women who are Black, Hispanic, American Indian or Asian are more likely to develop gestational diabetes. Coming to the complications. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less control your blood sugar, the higher the risk of complications. Eventually, diabetes complication may be disabling or even life-threatening. Possible complications include cardiovascular disease. Diabetes dramatically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, that is known as angina, heart attack, stroke, and narrowing of arteries, that is known as atherosclerosis. If you have diabetes, you are more likely to have heart disease or stroke. Nerve damage, that is known as neuropathy. Excess sugar can injure the walls of tiny blood vessels, which are capillaries that nourish your nerves, especially in your legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Left untreated, you could lose all sense of feeling in the affected limbs. Damage to the nerve related to digestion can cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. Kidney damage, that is nephropathy. The kidneys contain millions of tiny blood vessels clusters, which are known as glomeruli, that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which may require dialysis or a kidney transplant. Eye damage, that is retinopathy. Diabetes can damage the blood vessels of the retina, which is known as diabetic retinopathy, that can potentially lead to blindness. Diabetes also increases the risk of other serious vision conditions such as cataracts and glaucoma. Foot damage, nerve damage in the feet or poor blood flow to the feet increases the risk of various foot complications. Left untreated cuts and blisters can develop serious infections which often heal poorly. These infections may ultimately require toe, foot, or leg amputation. Skin condition, diabetes may leave you more susceptible to skin problems including bacterial and fungal infections. Hearing impairment, hearing problems are more common in people with diabetes. Alzheimer's disease, type 2 diabetes may increase the risk of dementia such as Alzheimer's disease. The poorer your blood sugar control, the greater the risk appears to be. Although there are theories as to how these disorders might be connected, none has yet been proved. Depression symptoms are common in people with type 1 and type 2 diabetes. Depression can affect diabetes management also. Coming to the complication of gestational diabetes. Most women who have gestational diabetes deliver healthy babies. However, untreated or uncontrolled blood sugar levels can cause problems for you and your baby. Complications of your baby can occur as a result of gestational diabetes that include excess growth. Extra glucose can cross the placenta, which triggers your baby's pancreas to make extra insulin. This can cause your baby to grow too large, that is known as macrosomia. Very large babies are more likely to require a C-section birth. Low blood sugar. Sometimes babies or mothers with gestational diabetes develop low blood sugar, that is hypoglycemia, shortly after birth because their own insulin production is high. Prompt feeding and sometimes an intravenous glucose solution can return the baby's blood sugar level to normal. Type 2 diabetes later in life. Babies or mothers who have gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. Death. Untreated gestational diabetes can result in a baby's death either before or shortly after birth. Complications in the mother also can occur as a result of gestational diabetes, including preeclampsia. This condition is characterized by high blood pressure, excess protein in the urine, and swelling in the legs and feet. Preeclampsia can lead to serious or even life-threatening complications for both mother and baby. Subsequent gestational diabetes. Once you have had gestational diabetes in one pregnancy, you are more likely to have it again with the next pregnancy. You are also more likely to develop diabetes, typically type 2 diabetes, as you get older. Complications of prediabetes. Prediabetes may develop into type 2 diabetes. Now coming to the prevention. Type 1 diabetes cannot be prevented. However, the same healthy lifestyle choices that help prediabetes, type 2 diabetes, and gestational diabetes can also help prevent them. The first is you should eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Strive for variety to prevent boredom. Get more physical activity. I aim for 30 minutes of moderate physical activity a day. Take a brisk daily walk, ride your bike, swim laps. If you cannot fit in a long workout, break it up into smaller sessions spread throughout the day. Lose excess pounds. If you are overweight, losing even 7% of your body weight, for example 14 pounds, that is 6.4 kilograms. If you weigh 200 pounds, that is 90.7 kilograms, can reduce the risk of diabetes. Do not try to lose weight during pregnancy. However, talk to your doctor about how much weight is healthy for you to gain during pregnancy. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. Motivate yourself by remembering the benefits of losing weight, such as healthier heart, more energy, and improved self-esteem. Sometimes medication is an option as well. Oral diabetes drugs such as metformin that come with the name of glucophage, Glumetza and others may reduce the risk of type 2 diabetes, but healthy lifestyle choices remain essential. Have your blood sugar checked at least once a year to check that you have not developed type 2 diabetes. Now coming to the diagnosis and treatment. First of all, diagnosis. Symptoms of type 1 diabetes often appear suddenly and are often the reason for checking blood sugar levels. Because symptoms of other types of diabetes and pre-diabetes come on more gradually or may not be evident, the American Diabetes Association has recommended screening guidelines. The American Diabetes Association recommends that the following people be screened for diabetes. Now I'll tell you about the people who should be screened. Anyone with a body mass index, that is known as BMI, higher than 25. 23 for Asian Americans, regardless of age. Who has additional risk factors such as high blood pressure, abnormal cholesterol levels, a sedentary lifestyle, a history of polycystic ovary syndrome or heart disease, and having a close relative with diabetes. Anyone older than age 45 is advised to receive an initial blood sugar screening, and then if the results are normal, to be screened every 3 years thereafter. Any woman who has had gestational diabetes is advised to be screened for diabetes every 3 years. Anyone who has been diagnosed with pre-diabetes is advised to be tested every year. Now coming to the test for type 1 and type 2 diabetes and pre-diabetes. First test is glycated hemoglobin A1C test. This blood test, which does not require fasting, indicates your average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to hemoglobin, which is an oxygen carrying protein in red blood cells. The higher your blood sugar level, the more hemoglobin you will have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests indicates that you have diabetes. An A1C between 5.7 and 6.4% indicates pre-diabetes. Below 5.7 is considered normal. If the A1C test results are not consistent, the test is not available, or you have certain conditions that can make the A1C test inaccurate, such as if you are pregnant or have an uncommon form of hemoglobin known as a hemoglobin variant, your doctor may use the other tests to diagnose diabetes. These include random blood sugar test. A blood sample will be taken at a random time regardless of when you last ate. A random blood sugar of 200 mg per deciliter or 11.1 millimole per liter or higher suggests diabetes. Fasting blood sugar test. A blood sample will be taken after an overnight fast. A fasting blood sugar level less than 100 mg per deciliter, that is 5.6 millimole per liter, is normal. A fasting blood sugar level from 100 to 125 mg per deciliter, that is 5.6 to 6.9 millimole per liter, is considered pre-diabetes. If it is 126 mg per deciliter, that is 7 millimole per liter, or higher on 2 separate tests, you have diabetes. Oral glucose tolerance test. For this test, you fast overnight and the fasting blood sugar level is measured. Then you drink a sugary liquid and the blood sugar levels are tested periodically for the next 2 hours. A blood sugar level less than 140 mg per deciliter, that is 7.8 millimole per liter, is normal. A reading of more than 200 mg per deciliter, that is 11.1 millimole per liter, after 2 hours indicates diabetes. A reading between 140 and 199 mg per deciliter, that is between 7.8 millimole per liter and 11 millimole per liter, indicates pre-diabetes. If type 1 diabetes is suspected, your urine will be tested to look for the presence of a byproduct produced when muscle and fat tissues are used for energy, because the body does not have enough insulin to use the available glucose, which is ketones. Your doctor will also likely run a test to see if you have the destructive immune system cells associated with type 1 diabetes called autoantibodies. Test for gestational diabetes. Your doctor will likely evaluate your risk factor for gestational diabetes early in your pregnancy. If you are at higher risk of gestational diabetes, for example, if you are obese at the start of your pregnancy, if you had gestational diabetes during a previous pregnancy, or you have a mother, father, sibling or child with diabetes, your doctor may test for diabetes at your first prenatal visit. If you are at an average risk of gestational diabetes, you will likely have a screening test for gestational diabetes sometime during your second trimester, typically between 24th and 28th weeks of pregnancy. Your doctor may use these screening tests, which I am going to tell you. Initial glucose challenge test. You will begin the glucose challenge test by drinking a syrupy glucose solution. 1 hour later, you will have a blood test to measure your blood sugar level. A blood sugar level below 140 mg per deciliter, that is 7.8 millimole per liter, is usually considered normal on a glucose challenge test, although this may vary at specific clinic or labs. If your blood sugar level is higher than normal, it only means you have a high risk of gestational diabetes. Your doctor will order a follow-up test to determine if you have gestational diabetes. Follow-up glucose tolerance testing. For the follow-up test, you will be asked to fast overnight and then have your fasting blood sugar level measured. Then you will drink another sweet solution, this one containing a higher concentration of glucose, and your blood sugar level will be checked every hour for a period of 3 hours. If at least 2 of the blood sugar readings are higher than the normal values established for each of the 3 hours of the test, you will be diagnosed with gestational diabetes. Coming to the treatment. Depending upon what type of diabetes you have, blood sugar monitoring, insulin and oral medication may play a role in your treatment. Eating a healthy diet, maintaining a healthy weight, and participating in regular activity also are important factors in managing diabetes. Treatment for all types of diabetes. An important part of managing diabetes as well as your overall health is maintaining a healthy weight through a healthy diet and exercise plan. Healthy eating. Contrary to popular perception, there is no specific diabetes diet. You will need to center your diet on more fruits, vegetables, lean proteins, and whole grains, which are foods that are high in nutrition and fiber and low in fat and calories, and cut down on saturated fats, refined carbohydrates, and sweets. In fact, it is the best eating plan for the entire family. Sugary foods are okay once in a while as long as they are counted as part of your meal plan. Yet, understanding what and how much to eat can be a challenge. A registered dietitian can help you create a meal plan that fits your healthy goals, food preferences, and lifestyle. This will likely include carbohydrate counting, especially if you have type 1 diabetes. Physical activity. Everyone needs regular aerobic exercise, and people who have diabetes are no exception. Exercise lowers your blood sugar level by moving sugar into your cells, where it is used for energy. Exercise also increases your sensitivity to insulin, which means your body needs less insulin to transport sugar to your cells. Get your doctor's okay to exercise, then choose activities you enjoy such as walking, swimming, or biking. What's the most important is making physical activity part of your daily routine. Aim for at least 30 minutes or more of aerobic exercise most days of the week. Bouts of activity can be as brief as 10 minutes 3 times a day. If you have not been active for a while, start slowly and build up gradually. Coming to the treatment for type 1 and type 2 diabetes. Treatment for type 1 diabetes involves insulin injection or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting. Treatment of type 2 diabetes primarily involves lifestyle changes, monitoring of your blood sugar, along with diabetes medication, insulin, or both. Monitoring your blood sugar. Depending on your treatment plan, you may check and record your blood sugar as many as 4 times a day or more often if you are taking insulin. Careful monitoring is the only way to make sure that your blood sugar level remains within your target range. People with type 2 diabetes who are not taking insulin generally check their blood sugar much less frequently. People who receive insulin therapy also may choose to monitor their blood sugar level with a continuous glucose monitor. Although this technology has not yet completely replaced the glucose meter, it can significantly reduce the number of finger sticks necessary to check blood sugars and provide important information about trends in blood sugar levels. Even with careful management, blood sugar levels can sometimes change unpredictably. With help from your diabetes treatment team, you will learn how your blood sugar level changes in response to food, physical activity, medication, illness, alcohol, stress, and hormone fluctuation in hormone levels. In addition to daily blood sugar monitoring, your doctor will likely recommend regular A1C testing, as I told you previously, to measure your average blood sugar level for the past 2 to 3 months. Compared with the repeated daily blood sugar test, A1C testing better indicates how well your diabetes treatment plan is working overall. An elevated A1C level may signal the need for a change in your oral medication, insulin regime, or meal plan. Your target A1C goal may vary depending on your age and various other factors such as other medical conditions you may have. However, for most people with diabetes, the American Diabetes Association recommends an A1C of below 7%. Ask your doctor what your A1C target is. Insulin. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. Many types of insulin are available, including rapid-acting insulin, long-acting insulin, and intermediate options. Depending upon your needs, your doctor may prescribe a mixture of insulin types to you throughout the day and night. Insulin cannot be taken orally to lower blood sugar because stomach enzymes interfere with insulin action. Often, insulin is injected using a fine needle and syringe or an insulin pen, a device that looks like a large ink pen. An insulin pump also may be an option. The pump is a device about the size of a cell phone worn on the outside of your body. A tube connects the reservoir of insulin to a catheter that is inserted under the skin of your abdomen. A tubeless pump that works wirelessly also is now available. You program an insulin pump to dispense specific amounts of insulin. It can be adjusted to deliver more or less insulin depending on meals, activity level, and blood sugar level. An emerging treatment approach not yet available is closed-loop insulin delivery, also known as the artificial pancreas. It links a continuous glucose monitor to an insulin pump and automatically delivers the correct amount of insulin when needed. There are a number of versions of the artificial pancreas, and clinical trials have had encouraging results. More research needs to be done before a fully functional artificial pancreas receives regulatory approval. However, progress has been made towards an artificial pancreas. In 2016, an insulin pump combined with a continuous glucose monitor and a computer algorithm was approved by FDA. However, the user still needs to tell the machine how many carbohydrates will be eaten. Oral or other medications. Sometimes other oral or injected medications are prescribed as well. Some diabetes medications stimulate your pancreas to produce and release more insulin. Others inhibit the production and release of glucose from your liver, which means you need less insulin to transport sugar into your cell. Still others block the action of stomach or intestinal enzymes that break down carbohydrates or make your tissues more sensitive to insulin. Metformin, that is glucophage, is generally the first medication prescribed for type 2 diabetes. Transplantation. In some people who have type 1 diabetes, a pancreas transplant may be an option. Islet transplants are being studied as well. With a successful pancreas transplant, you would no longer need insulin therapy. But transplants are not always successful, and these procedures pose serious risks. You need a lifetime of immune suppressive drugs to prevent organ rejection. These drugs can have serious side effects, which is why transplants are usually reserved for people whose diabetes cannot be controlled or those who also need a kidney transplant. Bariatric surgery. Although it is not specifically considered a treatment for type 2 diabetes, people with type 2 diabetes who are obese and have a body mass index higher than 35 may benefit from this type of surgery. People who have undergone gastric bypass have seen significant improvement in their blood sugar level. However, this procedure long-term risks and benefits for type 2 diabetes are not yet known. Treatment for gestational diabetes. Controlling your blood sugar level is essential to keeping your baby healthy and avoiding complications during delivery. In addition to maintaining a healthy diet and exercising, your treatment plan may include monitoring your blood sugar and in some cases using insulin or oral medication. Your doctor also will monitor your blood sugar level during labor. If your blood sugar rises, your baby may release high levels of insulin, which can lead to a low blood sugar right after birth. Treatment for pre-diabetes. If you have pre-diabetes, healthy lifestyle choices can help you bring your blood sugar level back to normal, or at least keep it from rising toward the level seen in type 2 diabetes. Maintaining a healthy weight through exercise and healthy eating can help. Exercising at least 150 minutes a week and losing about 7% of your body weight may prevent or delay type 2 diabetes. Sometimes medications such as metformin, glucophage also are an option if you are at higher risk of diabetes, including when your pre-diabetes is worsening or if you have cardiovascular disease, fatty liver disease, or polycystic ovary syndrome. In other cases, medication to control cholesterol, statins in particular, and high blood pressure medications are needed. Your doctor might prescribe low-dose aspirin therapy to help prevent cardiovascular disease if you are at higher risk. However, healthy lifestyle choices remains the key. Now I'll tell you that there are some signs of trouble in any type of diabetes, because so many factors can affect your blood sugar. Problem may sometimes arise that require immediate care, such as hyperglycemia. Your blood sugar level can rise for many reasons, including eating too much, being sick, or not taking enough glucose lowering medication. Check your blood sugar level as directed by your doctor and watch for signs and symptoms of high blood sugar. Frequent urination, increased thirst, dry mouth, blurred vision, fatigue, and nausea are signs of hyperglycemia. If you have this, you will need to adjust your meal plan, medication, or both. Increased ketones in your urine, that is a condition which is diabetic ketoacidosis. If you excess the stuff for energy, your body may begin to break down fat. This produces toxic acid known as ketones. Watch for loss of appetite, weakness, vomiting, fever, stomach pain, and a sweet, fruity breath. You can check your urine for excess ketones with an over-the-counter ketone test kit. If you have excess ketones in your urine, consult your doctor right away or seek emergency care. This condition is more common in people with type 1 diabetes. Hyperglycemic hyperosmolar non-ketotic syndrome. This condition with signs and symptoms of this life-threatening condition include a blood sugar reading over 600 milligram per deciliter, that is 33.3 millimole per liter. There are symptoms such as dry mouth, extreme thirst, fever, drowsiness, confusion, vision loss, and hallucination. Hyperosmolar syndrome is caused by sky-high blood sugar that turns blood thick and syrupy. It is seen in people with type 2 diabetes. So the difference between the diabetic ketoacidosis and hyperglycemic hyperosmolar non-ketotic syndrome is that the former occurs in type 1 diabetes and this one occurs in type 2 diabetes. And this is often preceded by an illness. Call your doctor or seek immediate medical care if you have signs or symptoms of this condition. Low blood sugar, hypoglycemia. If your blood sugar level drops below your target range, it is known as low blood sugar hypoglycemia. If you are taking medication that lowers your blood sugar, including insulin, your blood sugar levels can drop for many reasons, including skipping a meal and getting more physical activity than normal. Low blood sugar also occurs if you take too much insulin or an excess of glucose lowering medication that promotes the secretion of insulin by your pancreas. Check your blood sugar level regularly and watch for signs and symptoms of low blood sugar, which includes sweating, shakiness, weakness, hunger, dizziness, headache, blurred vision, heart palpitation, irritability, slurred speech, drowsiness, confusion, fainting, and seizures. Low blood sugar is treated with quickly absorbed carbohydrates such as fruit juice or glucose tablets. Now I'll tell you some lifestyle and home remedies. Diabetes is a serious disease. Following your diabetes treatment plan takes round-the-clock commitment. Careful management of diabetes can reduce your risk of serious, even life-threatening complications. You should make a commitment to managing your diabetes. Learn all you can about diabetes. Establish a relationship with a diabetes educator and ask your diabetes treatment team for help when you need it. You should choose healthy food and maintain a healthy weight. If you are overweight, losing just 5% of your body weight can make a difference in your blood sugar control. If you have pre-diabetes or type 2 diabetes, a healthy diet is one with plenty of fruits, vegetables, lean proteins, whole grains, and legumes with a limited amount of saturated fat. You should make physical activity part of your daily routine. Regular exercise can help prevent pre-diabetes and type 2 diabetes, and it can help those who already have diabetes to maintain better blood sugar control. A minimum of 30 minutes of a moderate exercise such as brisk walking most days of the week is recommended. A combination of exercises which are aerobic exercises such as walking or dancing and most days, combined with resistance training such as weightlifting or yoga twice a week, often helps control blood sugar more effectively than does either type of exercise alone. It is also a good idea to spend less time sitting still. Try to get up and move around for a few minutes, at least every 30 minutes or so when you are awake. In addition, if you have type 1 or type 2 diabetes, you should identify yourself. Wear a tag or bracelet that says you have diabetes. Keeping a glucagon kit nearby in case of a low blood sugar emergency, and make sure your friends and loved ones know how to use it. You should schedule a yearly physical and regular eye exam. Your regular diabetes checkup are not meant to replace yearly physical or routine eye exam. During the physical, your doctor will look for any diabetes-related complication and screen for other medical problems. Your eye care specialist will check for signs of retinal damage, cataracts, and glaucoma. Keep your vaccination up to date. High blood sugar can weaken your immune system. Get a flu shot every year, and your doctor may recommend the pneumonia vaccine as well. The Center for Disease Control and Prevention, that is CDC, also currently recommends hepatitis B vaccination if you have not previously been vaccinated against hepatitis B and you are an adult ages 19 to 59 with type 1 or type 2 diabetes. The most recent CDC guideline advise vaccination as soon as possible after diagnosis with type 1 or type 2 diabetes. If you are age 60 or older or have diabetes and have not previously received the vaccine, talk to your doctor about whether it is right for you. You should pay attention to your feet. Wash your feet daily in lukewarm water. Dry them gently, especially between the toes. Moisturize with lotion but not between the toes. Check your feet every day for blisters, cuts, sores, redness or swelling. Consult your doctor if you have a sore or other foot problem that does not heal properly on its own. You should keep your blood pressure and cholesterol under control. Eating healthy food and exercising regularly can go a long way towards controlling high blood pressure and cholesterol. Medication may be needed too. You should take care of your teeth. Diabetes may leave you prone to a more serious gum infection. Brush and floss your teeth at least twice a day. And if you have type 1 or type 2 diabetes, schedule regular dental exam. Consult your dentist right away if your gums bleed or look red or swollen. If you smoke or use other types of tobacco, ask your doctor to help you quit. Smoking increases your risk of various diabetes complications. Smokers who have diabetes are more likely to die of cardiovascular disease than are non-smokers who have diabetes, according to the American Diabetes Association. You should talk to your doctor about ways to stop smoking or to stop using other types of tobacco. If you drink alcohol, do so responsibly. Alcohol can cause either high or low blood sugar depending on how much you drink and if you eat at the same time. If you choose to drink, do so only in moderation. 1 drink a day for women and 2 drinks a day for women, and always with food. Remember to include the carbohydrates from any alcohol you drink in your daily carbohydrate count, and check your blood sugar levels before going to bed. You should take stress seriously. The hormones your body may produce in response to prolonged stress may prevent insulin from working properly, which will raise your blood sugar and stress you even more. Set limits for yourself and prioritize your tasks. Learn relaxation techniques and get plenty of sleep. I should tell you some alternative medicine. Numerous substances have been shown to improve insulin sensitivity in some studies, while other studies failed to find any benefit for blood sugar control or in lowering A1C level. Because of the conflicting findings, there are not any alternative therapy that are currently recommended to help everyone with blood sugar management. If you decide to try any type of alternative therapy, do not stop taking the medication that your doctor has prescribed. Be sure to discuss the use of any of these therapies with your doctor to make sure that they won't cause adverse reaction or interact with your current therapy. Additionally, there are no treatments, alternative or conventional, that can cure diabetes. So it is critical that people who are receiving insulin therapy for diabetes do not stop using insulin unless directed to do so by their physician. This was a very long topic and I hope I have covered everything. If you have any questions, you can post your comments in the comment section of this video. Until now, if you have not subscribed my channel, please do so and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think my video provides some sort of benefit, even if it is little bit benefit, please like the video and share this video with your family and friends. And also please share this video through social media, because I want to help the humanity, help humanity, and that's why I have created this channel known as Hube Tabibi. And I want my message to be conveyed all over the world so that more and more people get benefit from my health related videos. Thank you very much for watching this video. See you in next video. Bye for now.